Hi, welcome back to Golf Training Hacks. Do you have back pain? You know, sometimes when you have back pain, you also might have very tight hamstrings and adductors. Now, the adductors are the muscles that run on the inside of your leg. And here's why. Often back pain has to do with misalignment in your hips. Now, if your hips are rotated too far forward, since your hamstrings are attached to the bottom of your pelvis, when your hips or your pelvis is rotated too far forward, it stretches the hamstrings and it keeps them on that stretch and they get tight. So in order to loosen that hamstring up, you need to organize the pelvis better and get that rotation more normal. That will release the tension in the hamstrings. But think about it. Since the spine sits on the pelvis, if your pelvis is rotated too far forward and misaligned, then your spine will also be misaligned. Now, due to all the rotational forces, compressive forces, and shearing forces in the golf swing, if your hips and spine are misaligned, you're at a heightened risk for injury when you're swinging a golf club. You know, even in the best of cases, when your back is fine and there is no misalignment, swinging a golf club puts a lot of stress on your back. So to have it misaligned and swinging a golf club and accumulating all those repetitions really puts you at a heightened risk for injury. So in this video, we want to help you work on improving the alignment of your pelvis first, and then once you get your pelvis aligned better, we can work on improving the pliability of the hamstrings and the adductors. Now, when you're working on any movement or trying to create a better alignment, you have to think of your body as a system of systems. We're not discrete units of muscles and tendons and joints and bones. Everything works together. So if you don't address it as a system, it's really tough to make improvements in your movement. So in this video, we're going to help you address the system of your hips, your upper legs, and your lower back so that you can improve your alignment of your pelvis. That's going to improve the alignment of your spine, and that's going to reduce the tension in your hamstrings and adductors. So let's get started. In this exercise sequence, we're going to show you some basic exercises to improve your hip strength, and in particular, your glute max strength. The first one, again, this is going to be some basic exercises. I'm sure you guys have seen this. Cheryl's going to do a hip bridge. We're going to hold it isometrically. 1, 2, 3, 4, 5. So you're going to release, come back up. We'll do 3 reps. 1, 2, 3, 4, 5, and release. And come back up again. And 1, 2, 3, 4, 5, and release. Okay, so you don't have to hold it for 5 seconds. You could hold it for 10, 15, 20, a minute. You know, it's up to you. It's based on your capabilities. The second type of hip bridge, and we use these a lot, is a hip bridge with single leg movement. Now, in this case, Cheryl's just going to do a hip bridge with a single leg pump, which is just an open movement. So she's going to come up and she's going to pump her leg back and forth 3 times. 1, 2, and 3. Good. So that's a beginning of our hip bridge sequence. It's some basic exercises to begin to get you some strength in your glute max in particular here. In this exercise segment, we're going to help you work on isometric strength in your hips. Now, you need isometric strength in your hips to stop lateral glide. You need to be able to stop the rotational forces and the lateral forces as you swing a golf club. And isometric strength is what you need to help you stop doing that. Now, we're going to start with a hip bridge. So I think you all know what a hip bridge is. Cheryl's going to do one. That's a basic hip bridge, right? And come on down. But we're going to change it up in that we're going to do a hip bridge with single leg movements. Now, the first movement we're going to do is a hip bridge into what we call a single leg concentric push. So let's go into a hip bridge. Cheryl's going to put her leg up, and now she's going to push into my hand, and I'm going to release, and it's going to go back. Now, she could come out of this now if she wants to come down. If you don't want to hold the hip bridge throughout this, you can. You come back up. She's going to push into my hand and come back down. And one more. Go down and up. Push into my hand and come back down. Okay? That's a hip bridge with a single leg concentric push. But here's where we're going to change it up a little bit. We're going to put an isometric contraction at the end of the push. So this is a hip bridge with a single leg concentric push with an isometric contraction at the end. All right, so Cheryl's going to come up into a hip bridge, and now we're going to push, and we're going to go into an isometric contraction. 1, 2, 3, 4, 5. Release, push, 1, 2, 3, 4, 5, release, and push. 1, 2, 3, 4, 5, and release. Okay, so that's a hip bridge with a single leg concentric push and an isometric contraction at the end. In this video, we'll use a roller to work on adductors to get some pliability in here. Put your inner thigh on the roller. You can roll up and down to see if you have any sore spots. But really what you want to do when you're using a roller is to do several things. You certainly don't want to just roll up and down. That's really counterproductive. We use that just to find some trigger points or sore spots. So let's say that this is a spot I want to work on. What I can do is simply breathe into this spot, take a deep breath, in through your nose, and out through your nose. And let that trigger point release. Breathe in. And just let the weight of your leg sink into that trigger point. That's one way. The other way is to go across the area that hurts. So you roll across it. That's number 2. The third way, and by the way, you're always breathing. I mean, I'm talking now, but as I'm doing this, I should be breathing in and out through my nose. You don't have to go fast. You don't have to be like this. Nice and easy. Now, if I find a spot there that is sensitive, let's say that's the spot, I can also tack it down, just hold it there, and move my leg. Get movement in different orientations. And I'm breathing. Now, breathing sends the neurological signal that the position that you're in is okay. And you can find different spots. You go higher, you can go lower towards the knee, and you do the same thing. So that's a great way to get some pliability into the muscles on the inner thigh or the adductors. So when you're trying to improve the extensibility or the mobility in your hamstrings, what people often disregard is the connection between the high portion of your hamstring and your pelvis. They're connected. So we're going to use a lacrosse ball or a tennis ball to begin to mobilize that area. So you can start with a tennis ball or a lacrosse ball, but I would suggest starting with a tennis ball. And you're going to place the ball right at the intersection or the interface between your pelvis and your hamstring. And you're just going to work that position and try to scour around a little bit or find some areas that might be a little tender. Once you do, you can just breathe and let the weight of your body sink into that position. So I'm going to take a deep breath in through my nose and out through my nose. And just let the weight of my body sink into the ball. You can move it around. And of course, I would spend more time on this, but this is just for demonstration purposes. You want to spend at least 2 or 3 minutes on these positions, longer if you want. You can just kind of move the ball around and find some spots that are tender, or you can actually tack down that spot and move your leg. You can move it side to side, back and forth. Out here you can move it, and you can just try to find areas that are tender. And if you breathe when you're doing this, you're sending a neural signal to your neurological system to relax, and this position is okay. Breathing is so important. Pressure and breathing will release these trigger points. Muscles, tissue shouldn't feel pain when you're pressing on them. So you can release it on your own if you do it right, and that's with breathing. You do it slow, you spend some time. A great way to open up your adductors and work your hips at the same time is an adductor rock. Let me show you how that works. So to do an adductor rock, you want this one side out and this knee down, and you're going to rock into this side. Now you can stay like this, but I use my hands to support myself because I really want to get down into this position. This foot stays flat and pointed forward as best you can. Then you come up, you look up, and then you rock into this foot. Look up, come back, sit back as best you can, come up. Now I'll show it from the side. Okay, from the side position, this foot goes out, this knee is down. I sit back into this leg as best I can. I try to keep this foot down and point it forward, and I turn into this side. The adductor rock, it's a great way to work your hip and your adductors at the same time. In this video, we'll work on some internal rotation. Now, I'm sure many of you are familiar with this 90-90 position, this to stretch your hips. So in this position, you can turn into it that way. You can turn into it this way. You can go forward and turn. Press into the ground. But we can also use a band to set the hip in a better spot and get more out of this stretch. And I'll show you how to do that. So I have a band hooked up to this plyo box. I'm going to put it around my leg. Bring this band up tight. Then I'm going to get back into that 90-90 position so that the band is pulling my hip that way. It's setting the hip joint more towards the rear of the socket, and then I can do the same thing. So turn out this way. I need a little more tension on that. Maybe you can use a bigger band, obviously, if you need it. So, and you should be breathing. Deep breath in, and in through your nose, out through your nose. And just hunt around and find where you might be stiff. You can also use isometrics to get a little bit more work done by pressing your knee into the ground. So take a deep breath in, press your knee into the ground, hold it for 4 seconds, 1 1000, 2 1000, 3 1000, 4 1000. Release the breath through your nose, and then find a new position. So you can be back here now. Deep breath in, press 1 1000, 2 1000, 3 1000, 4 1000, and release. So you're really just trying to hunt around. You can go into this way, just trying to hunt around and see where you're stiff. Now, I feel a lot of stiffness here, so I'll take a deep breath in, press 1 1000, 2 1000, 3 1000, 4 1000, and release. So I'm pretty stiff going this way, and I would work on that. So that's one way to improve the effectiveness of this 90-90 stretch using a band.